from your discussion for the super pulse TFL and its application in urolithiasis. You have rich experiences, and I very much look forward to more application of this good tool in lithotripsy and make our clinical work more convenient so that it works better with the flexible endoscope lithotripsy. In a clinical setting, we have already tried this tool, this technology, and we know that our international counterparts, they have even more experiences than us. And today we're very honored to invite an expert from India, from Preeti Urinary and Kidney Hospital, Professor Mohan, to give us a surgical video introduction and experience sharing on sTFL. And we are also very honored to invite experts from Beijing Hospital, Professor Liu Ming, as well as Professor Wang Gang from Peking University No. 1 Hospital. Professor Liu Ming is a standing committee member of China Medical Association Urology Committee. This is actually the top society in China in urology, and he is a key expert, key KOL in this area. Professor Wang Gang is also a top expert in urolithiasis, and he is also a top KOL in urolithiasis, a standing committee, actually vice chair of the urolithiasis committee of China Medical Association. And later, after Professor Mohan's presentation, we would have a panel discussion. And now, without further ado, let's invite Professor Mohan from India to give you a talk. The floor is yours.
Respected Professor Zhu Wei and the moderators and the Chinese Urological Association and the Raykeen and previous speaker, Professor Wilson Molina, warm welcome from Preeti Urology and Kidney Hospital. I thank once again for giving me this opportunity to speak on hard stones, how the TFL works. I will try to show this in video based presentations. We have started using thulium fiber laser, super pulse laser in 2018 December. The first time it was launched in India. I was fortunate to use it first time in India as a part of the live workshop. We realized that high frequency of the laser has made a lot of difference. Now the comparison is between holmium laser 30 watts and super pulse laser 30 watts. Similarly, thulium fiber laser 60 watts versus 100 watts holmium laser. Everyone says that for last 2 decades, holmium 100 watts is used more for enucleation of prostate than for stone. 30 watts is used for stone. So comparison between 30 and 60 watts may not be appropriate, but let us see how in hard stones we can do better with new laser. With this introduction, I like to share my screen with the permission of the chairperson. My talk is video based video explanation and experience sharing of TFL lithotripsy. So as already the talk has been given introduction by Wilson Molina, I will quickly go through the slides. There are no conflicts of interest. A lot of hype about thulium fiber laser in the recent times presents a potential paradigm shift in laser lithotripsy. It is now, when we have used in 2018, lot of controversy was there, but in 2019 FDA approved and 2020 European CE mark approval has been given. After that, usage in the Western countries increased a lot with this laser. There are various types of laser, but we are using the IPG photonics in India predominantly. As you all know, the main difference between these things is here the energy is delivered after it passes through the thulium doped ions from the diode laser. So no flash lamps. That's why a small laser fiber also can deliver the energy in the future. That is the main argument. Already, as Wilson Molina said, 150 micron laser fiber, even I am using it, whereas 50 micron is possible in the future. But whether it can withstand high energy or not is debatable. Important part of the TFL has already been discussed is my point of view, low energy, high frequency. As low as 0.025 joules. Can you imagine in holmium we have only up to 0.4, 0.5 joules. It is nearly 10 times lower than that. So if you can use less energy and do popcorn, it is better. Whereas frequency is nearly 100 times up to 10 times to 100 times more. That is 2400. Normally in 100 watts holmium laser we use up to 80 Hz. Here it is 2400, but usually in TFL we use 100, 200, 300. What will happen after 300 in hard stone? If you use, lot of storming effect will come and you will lose the vision. That's why more than 200, 300 may not be required in the mission. Even then it is 10 times more than the holmium laser. This slide is the most important difference in the functional aspect in large stone volume. So energy is 10 times lower, frequency is 25 times more, maximum peak power is 4 times less. That's why it can be used with a simple plug. Lot of holmium yag is dispersed, whereas thulium fiber is precise. Future small digital scopes, already we are using lot of scopes from the China, Poussin scope, much innovative, less than 8 to 9 French scopes are going through the smaller access sheath. In such cases we can reduce the lumen size also, working channel lumen size from 3.4 in the future with 50 micron laser fiber to do inferior calycial stones. Energy efficiency, it is 12%. So you can plug like a dry cleaner plug, a simple 3-point plug of dry cleaner can be used. Less energy consumption naturally because there is no heat produced inside the mission. What I mean to say, easy installation, this is the main important. Last 3 years I am using 3 missions in my 3 hospitals. None has got difficulty in installation. There is no need for special wiring. Only less than 5 amperes are required. This is portable. In India, lot of young urologists do movement from one place to other place to do the cases. It is only 36 kg. Simply the operational modes are dust, fragment, popcorn combinations. 2 foot pedals are there. You can use either way depending on the indication on the screen. The commonest settings Professor Wilson Molina has discussed in detail. I will talk only relevant to the hard stone in video based presentation. These are the settings: dusting, fragmentation and fragmentation with high energy. Non-contact lithotripsy is nothing but popcorning, 100 to 200 Hz, 0.1 to 0.2 joules. I mention again, 0.1 to 0.2 joules is required to break very small stones, however hard they are. 0.1 to 0.2 joules is sufficient when the stone is very small, irrespective of the Hounsfield units. That makes easy in large stone volume. Dusting mode is this: 0.1 to 0.8, 60 to 550 Hz. See the dust, this is one of the hard large stone. In the initial part, dusting is same with holmium, same with thulium. You cannot do very fast with thulium. In my impression, this type of dusting initially takes time. Now fragmentation mode, 1 to 6 joules, 6 to 55 Hz. You see, purposefully you are breaking the stone, but this is not very hard stone. You purposefully kept at 1 joule and 10 Hz aim is dust only. If you are aiming for dust, in fragmentation mode 110 is also very good. Now see, this is the pure fragmentation. You make 2 joules and 10 hertz. You make a designer cut. You make hole in the center and make pieces. Once they float, you go for the popcorn. This is the popcorn, very important part of thulium fiber laser, 0.025 to 0.2, 240 to 2200. See here, the stone is hard and it made into reasonably small pieces less than 5 mm, 7 mm. Then you do popcorn. See, now we started popcorn. See the storming effect. If it is more, see the powder quality. All you need is keep in the center for some time and just wait. No skill required, respiratory movement little less. All you require is a localized calyx. It cannot be done easily in a large pelvis. A localized calyx. So bring all the large stones into calyx and then do the surgery. Now I am showing my cases. Before I show my cases, my method of doing in large stone is preferably put the stent. In all, I am showing 8 cases here. Preferably put the stent. Use little larger access sheath. Use digital scope for better vision, and then start with initially painting to assess the mission as well as the outflow of the fluid. Once you are confident, make the pieces like pneumatic lithotripsy into pieces and then go for popcorn. This is the only way you can finish in case less than 30 to 45 minutes. We have this year European Urology Association, we are presenting the same paper, and we already published this in Indian Journal of Urology, that traditional classical dusting may not be there in future with the application of thulium fiber laser. You break the stone, you put the pieces in a localized room and then apply popcorn. But only problem is, popcorn will be useful only when the stones are of reasonably small size. If they are not small, the wobbling and popcorning effect will not be there. So your aim is to make fragment chipping, make them reasonably small size stones. After that, don't worry about the dust. It will churn and make the small fragments into the very fine dust. But all one condition is you should have a localized cavity. With this introduction, these 8 cases, I will finish my talk in another 15 to 20 minutes in the stipulated time. See, this is the 60 watts thulium fiber laser, large stone in the pelvis. Like this is a small X-ray, and see the compact system here. Any large stone is good case for PCNL. We are talking about, can it be done with RIRS? So when you go inside in a post-stented case, this is the system, and once you go inside, once you see the stone, you will have little bit of time for first few minutes, so that the, see now here 1 and 10 joule, this initially becomes dust only, but you can make fragments also. Half of the stone if you do dust, rest of the half can be made into pieces, so that the volume of the stone for popcorning will be less. But in future this may not be required. Voluntarily, purposefully you make the fragments. But this is difficult in pelvis. In calyx it is very easy. Large stones will occupy the pelvis also, so one should try to balance between the dusting and making the fragments. With homium, we try to dust as much time as possible, whereas with thulium, we try to dust and then quickly go to the fragmentation. Now we are entering into fragmentation mode with little high energy, 1.5 joules and 10 hertz. So you are making a holes in drilling. By drilling, you make the stone weaker. This is a designer cut. See, it has become 2 pieces. This is like pneumatic lithotripsy. The advantage of this laser is you can make small holes. This technique, making holes in the stone. In homium laser, if you make these type of holes, blast sheet can go. But in thulium, see, slowly these fragments are moving into the calyx. They have gone into the upper calyx. push them after making 2-3 pieces and then enjoy the luxury of high frequency. Now all these stones have gone into the upper calyx. The clearance rate also will be better, and now you go inside, make quick fragmentation. Once you are in the calyx, you don't have fear, they don't go anywhere. Quickly you fragment like pneumatic lithotripter. Fragment by the chipping peripheral, as Molina sir told, or in the center. Whatever the way you do it, make it to reasonable fragment. This is all fragmentation. I have not used popcorn yet. This is fragmentation. How fast you make them pieces is your skill. Especially now we switched over to popcorn. See, there is no skill now. Just wait. Keep on doing. This can also happen with this is one basket is kept into the upper calyx. That also you make fragment and powder. All you need to spend, previously Oliver Traxler sir used to say 4 minutes. It all depends on the volume of the small stones. But at the end we have seen that the dust quality is much better than the holmium laser dust. So at the end, no intravasation, no extravasation, but you have to spend some time, keep the scope moving out and in the access sheath and wash. Now second stone, upper calycial, hard stone, 2 centimeter. Any upper calycial stone, supracostal puncture is required, but in thulium fiber laser or holmium laser, see, this is a stone. You directly go into the system and directly start breaking into the fragments. If it is this is a hard stone, this is a small stone in the inferior calyx, basketed. Always better bring all these small stones in one place and then start making fragments, so that you will save a lot of time. In hard stone small, if you bring them to the large stone, it also will receive the fragmentation. It also will receive the popcorning effect, so that we have written this paper, number of these stones available for the, see, this is fragmentation voluntarily. You are not attempting any powder here. Voluntarily we are making more fragments available for popcorn and then keep on doing. Secret is 200 Hz. This is the large stone. Initially it won't break. Try to break, but it will take time. In that case, from periphery you can chip, in the center you can make hole. From periphery you chip, from the center you make hole, so that ultimate aim is weaken the stone, like what we do in the large stones are broken outside for building construction. You make it weak, then it becomes 4-5 pieces, then slowly faster fragmentation happens, faster popcorn happens. This I felt that after using 10 years with holmium 60 watts, holmium 30 watts, I was not able to do this fast popcorn with holmium. That is the major difference I wanted to share, that as early as possible you make the stone fragments and then do continuous popcorn for more than 5 minutes, 6 minutes. Then the question of temperature will come. If the water outflow is not there, definitely temperature will rise. No energy can break the stone without raising the temperature. So I personally feel, when I observe the outflow water with my gloves, it will be little hot, no doubt. But if you stop for half minute, give good irrigation, then the temperature effect will go. That's why initial phases better not to use more than 1.5 joule and more than 100 Hz. That means 15 to 20 watts. Please keep cut off. Still you can do good popcorn. See, it is completely powdered, less skill. All anesthetist need is keep it static for some time at low tidal volume, so that you keep the center laser fiber and keep on doing popcorn. See the picture, no intravasation, no extravasation. Very large stone, third case, very dense stone with fat in the extra renal, and once you go inside, the outside part was looking dihydrate, but as the time goes on, central core was very hard. The other important point in thulium fiber laser is sparking effect and blackening effect. This will happen in two conditions. One is very hard stone, second is when you touch too much this stone, and third, it will also happen if the energy is more than 2 joules. So my dear friends, when you are using this laser, initially, because the settings are so wide, please start with low energy, low frequency, then keep on increasing. Your own skill, your own method of doing the dusting, your own method of doing the popcorn, all will matter apart from the stone. Don't keep the laser fiber close to the scope. Till now I have not got damaged because of the sparking, but sparking happens. When sparking happens, better go see some amount of sparking here. Better to go away from the scope. See, this is fast dusting. This is not actually fragmentation. Initially, whatever you use, it won't fragment because volume and density will be so high. Like in pneumatic lithotripter, laser can never do. The surface area of the laser fiber is so small, you cannot expect terrible breaking of the stone within 2 minutes. It will take time. That may take around 10 to 15 minutes of time. After that, you will see a great difference between holmium laser and thulium fiber laser. Now see, at this stage, holmium and thulium are same. As the time passes, when the density is less, you can make into the multiple pieces. The moment you make into 2, 4, 6 pieces, the beauty of thulium fiber laser starts because of frequency and increased energy. Both can be combined at a time. See, now I am making fragments slowly at this juncture. This is a classical case where a large stone volume. Honestly, these cases are finished in less than 1 hour. Why I am mentioning 1 hour is 1 hour is a good amount of time to spend in the kidney, more than which time the kidney may get swollen and it may get edema and post-operative complications may increase. So our aim is, if we can do the stone of 3 centimeter, approximately volume of more than 1500, then in 1 hour, that is pretty good. Then it gives a great challenge to PCNL. Now already entire world less than 1.5 centimeter PCNL is replaced by RIRS. I heard in China, you people do more than 10 to 15 cases of mini-per previously. Now the theater, the stone volume is so high that you are doing 10-15 cases of RIRS also. That's why disposable scope is more commonly used in China. This is the 4th case where hard stone is present, very hard stone from the beginning, inferior calycial stone. Even if you don't want to replace, you can primarily do in situ. Primarily in situ you can do large stone only because of fragmentation. In the CT it may look small, but because of the 2 stones, the volume is more. In future, volume will be the guideline criteria than stone size. 2 into 2, see, this is bifid system. We can go into that stone. There is no need to do, this is the disposable scope which we use more here, Biorad Indovasive. I am also using Pusen, which is a very good scope again from the China. These scopes are flexible and their vision is good. Now once you inspect all the calyces for small stones, see the stone, 2 stones, they may not be, they may look small, and I am not putting in the upper calyx, I am putting in the reasonable accessible calyx. I will see where my scope moves fast and there I will lodge. This is in the upper calyx only, sorry. And then we are going, we take both these stones. Why? Because energy can be dissipated to the both the stone fragments. Now see here, voluntarily I wanted to fragment, but initially it won't fragment so well. See, I am perforating in the center. This is the in situ, because this could not be basketed. In situ we are doing, see, this become fragments. This is the aim, to do hard and large stone. This is the aim. Once you make these fragments reasonably small like popcorn, now see, these are reasonable fragments. Now you apply the 0.15 joules, 100 Hz in the inferior calycial stone. All you need to spend time so that it becomes fine powder. Don't come out in hurriedly. If you come out hurriedly, some amounts of fragments will be retained and your stone free rate will be seriously affected. Now I will go to the upper. See, this is the washing effect. If you come to the pelvis and upper ureter with a large access sheet, better to wash all this. Otherwise, this powder also can form nidus, because with matrix, with coagulum of the blood, they can form a stone again. That will be nuisance even if I have done a very good powder. So better to wash. See, now I am into the upper calyx. I have kept high jowls. I am powdering, I am breaking, pop dusting, then last popcorning. So combination is used very fast. Aim is to reach the popcorn as early as possible. So ultimately both the stones could be finished in less than 40-50 minutes. In that case, this gives a competition to the PCNL technique even if the stones are hard. So we should not compare RIRS with ESWL. We should compare RIRS with PCNL. This is the post-operative picture. Now coming to the inferior calyceal stone. This is actually unedited video we made where 8 minutes 1.5 centimeter stone is finished. This is pushed back 8 minutes. Time is important in RIRS. It is not the greatness. It is the technical feasibility. Now see here, we are not basketing here. We are going with 150 micron laser fiber. Method is same. You start making the hole and weaken the stone. Like the pillars are made weaken. In the center you make all multiple holes so that cracks will be created in the stone. Once the stone is broken, then popcorn be applied. Now I will be moving fast forward because the technique is same. How many cases I show, technique is same. See, now I am coming back and forth and making pieces. This needs little art. You have to make continuously because some amount of powder will be forming. Wash out and then touch, go, make fragments. Early fragmentation is the aim for a large and hard stone. See now, once I reach this stage, let it be 3 minutes or 5 minutes. After that, it finishes in less than 1 or 2 minutes. I am surprised that people are doing so much in less than 10 minutes. It's reality. This case was finished in 8 minutes, entire procedure lasing time. In that case, the irrigation side effects, sepsis side effects, all will be less. But one important point is, try to avoid any fragments keeping in the inferior calyx. There may be nidus for future and you will be disappointed after 1 or 2 years. So wash so that bring them into pelvis before you put the stent. So like this, if you apply some basic principles with this popcorn effect, we can really make this surgery easy and simple, and the classical dusting by professors shown may not be present in the future. In another 10 minutes I will be closing my talk. I am talking about large lower inferior calyceal stone again with a disposable scope. And see, this is a not very hard stone initially to start with. In fact, it is uric acid stone. These type of the stones will be finished very fast because fragmentation happens very fast. You see, sometimes in lower pole you have to bring out the laser fiber too much outside. That is also possible with this thulium fiber laser like in homium, and you make small holes. See how it is, stone is weakened immediately, how the stone has broken immediately. See, like this you perforate, and once you make small stones, go to the. So ultimate aim is fragmentation mode 1 joule and 10 Hz, and popcorn mode 0.1 joules and 200 is the crux for us. You need not remember entire gamut of the this thing, whatever you are comfortable. See, these are multiple stones, so there is no problem. Lot of vibration is created. One must keep in mind that irrigation is must and fluid outflow is must, otherwise RIS complications increase. If at all, one important point I want to give with thulium fiber laser is irrigation should be slow and steady. While doing popcorn, don't irrigate very fast, otherwise they get dispersed, and the outflow of the fluid should be continuously coming. Don't interrupt and stop, keep on going slow and steadily. You will achieve better results. This raises temperature in the kidney less. than. Definitely I have seen one ureteric stricture when I was doing large stone, pan-ureteral stricture has formed. It was my mistake because in URSL it is a unilateral flow, whereas in RIRS it is a bilateral. Water goes and comes out.
Here is a case of
This is a solitary kidney. We have done in pediatric also. We have a large series of pediatric published. Even in a 1 year baby we have done with the thulium fiber laser. There wasn't much effect. This is actually the relatively smaller age group. Now you go, this is fiber optic scope, Olympus P7 scope, and you go to all calyces, see the stone here, and same way, see the sparking. When you increase 2 joule, see the sparking effect with 2 joule. When you keep 2 joule, it breaks fast, it makes the holes fast, but you have tendency of forming the sparks as well as carbonization. Even I have observed many times, smell will come if you continuously use popcorn for more than 5 minutes. You get smell of the burning smell you get because stone gets burnt, vaporized. Naturally, it gives smell. And for this 1 minute or 30 seconds, if you stop the irrigation, and you will not have any effects. At least in RIRS, I have not seen any major side effects in these 3 years after doing more than 1,000-2,000 cases with TFL. Now we stopped using homium for the stone because we are because we have lot of cases. We do this is a scoliosis patient, nothing related to the hard stone, but bending. See the this is the scoliosis patient. So short stature, large stone. The patient scoliosis was this. It does not make any difference. What we feel that ectopic kidney and scoliosis patient, we better stent the case. 18 mm and 12 mm. See, large burden, 18 mm and 12 mm. See, this is the stone burden. All we have done is go inside, ensure that the C complex system. Even in supine PCNL and ECIRS, we use thulium fiber laser, and once we go inside, see how big the stone is. And initially 2 stones were there. We thought we will directly start, see the stone very long. We tried to take it out because it is very long. On an axis, you can see on the right side, you can compare and keep it in the upper part. Any given choice, large volume stones, hard stones, please prefer dependent calyx like upper calyx, not the inferior calyx. Any choice if you have, put it in the upper calyx. Your movements are fast. See, this case has gone very fast. The stone was actually 1000 ounce units, but it looks uric acid component also. See the dusting speed with the initial homium. This is the homium dusting. As I mentioned, dusting homium and thulium are same. After some time, I have taken thulium. In this case, we wanted to show both homium and thulium. To be honest, when you use both lasers without mentioning, you cannot identify which laser is what. See, this is good dusting by the homium also. So homium is not bad laser, but fragmentation and popcorn. See, now we are taking the thulium. See, this is a popcorn. Only for this effect we have taken. Another stone we have done with the thulium fiber laser to compare. See how much amount of fine dust is moving. In fact, if you keep more than 2 joules, you cannot see the stone. It is dangerous. You have to stop in between and do. That's why better to keep 1.5 joules. Now see, 0.2 joules and 275, very high. And in between you have to stop to produce this fine powder and get out. So these are the large stone volume which can be managed also with the see the amount of the dust, fine dust. This is a very fine dust, very fine dust. Ultimately you cannot give anything to the patient. Only see, this is the fine dust at the end, such a large stone. All dust ultimately is golden sand. Any stone looks yellow color like golden sand. My last case is ectopic pelvic kidney, where how thulium fiber laser can be used. 32 years old male patient, ectopic kidney. It does not make any difference. Only thing is you need some amount of space for action. If you don't have space, chances of irrigation will be there. Thulium fiber laser, if touches the other areas, it produces coagulation effect. So infundibular region, ureteric regions, please be careful. As Professor Wilson told, you should be used in the center and you should try to make fragment and remove with forceps. Don't spend too much time in the ureter. See how hard stone it is, round hard stone. No problem for thulium fiber laser. Even holmium does not make any difference for definitive setting, but only thing is it takes time. That time can be reduced by popcorning effect. That is the only difference between the holmium and thulium. See here, you make peripheral dusting, pop dusting, central holes, and then fragments. See, this is the way you make fragments faster. See, the central hard stone is there. One more side of the stone. If you rotate the stone, it will break fast. If you show the fresh surface, it shows fast. But we need not worry about the complete dusting, provided the stone is 1 calyx. So I am repeating the same. So I want to conclude that this is infundibulotomy. I want to show beautiful infundibulotomy. You can see on the right side, post pylolithotomy, stone was there. See here, scope was not going. You can nicely incise, very nicely you can incise, like in, see how it is separating, and its coagulation property is exceptionally good. We are doing enucleation and en bloc resection of the bladder tumor. Very handsome, very beautiful laser. See, all the upper 3 calyces, secondary stones, primary stones are all seen. Absolutely no bleeding. Only thing is restenosis. You have to be careful. Don't incise too much and coagulate. So to conclude my talk, ablation efficiency is very fast. Dust is very fast with a high frequency laser. Retropulsion definitely is less. Visibility is also not much affected if you keep less than 200 Hz. Safety, as of now, temperature is the concern. One has to be cautious because no randomized control trial, particularly from Russia, papers are there. NQ is the one who is doing pioneer work in IPG laser, and they say that the temperature, no difference is there. I have seen laser 5 burn back is very less. In enucleation, it's more. In bladder stone, if you use 600 micron fiber, it is more, but in RIRS it is very less. For one case, you need not cut. In the again, it will continuously glow. Naturally, if we compare 200 micron laser fiber between TFL and holmium, I personally feel TFL laser is little smaller appearance as well as feeling of resistance. It is also published. So this is the final summary slide of dusting, fragmentation, popcorn. It may vary from person to person, stone to stone, location to location, but this generally is a very good slide for newcomers. So absolute advantage of popcorn. Our experience is we have done around approximately we have done more than 30 cases in which average age is 40 years, average size of the stone is 18 mm, stone volume is 2100, density more than 1000. Usually it takes 20 to 30 minutes. Total energy used is very less. Laser efficacy, joules per cubic mm is very less, and ablation speed is very fast. So our research we are presenting this we have presented already in 2021 EAU that 60 watt super pulse is large volume stones for the efficacy. So use caution, impacted stones and long continuous activation when you are doing. To conclude, thulium fiber laser has good laser efficacy, faster and fine dust possible, works efficiently on hard and soft stones, versatile laser because it can be used in enucleation as well as en bloc. But at the end, when you are using high energy more than 25-30 watts, be cautious in the kidney. This is the first time in 2018 our unit has installed, first time in India. After that last 3 years we have maximum experience in 3 of our hospital, Preeti hospitals. These are the 9 urologists who are working with us and doing this work along with me at our Preeti hospital. Thank you once again for giving this opportunity and patient listening.
Okay, thank you. Very impressive, Dr. Mohan. And want to repeat that your strategy for the hard and big stone is that fragment first and then use popcorn mode to dust the stone. Is that right?
Yes. Yes.
And you find that thulium fiber laser is more effective when fragment and popcorn during this two mode. Okay, that's good. And also, I can see usually use 20 watts either in fragmentation or popcorn mode.
Yes.
You don't use higher energy. Is that because of the safety reason?
Yeah. There are two reasons. One is safety is definitely for RIRS. In bladder stones, only one time I have used 6 joules and 10 hertz. Very fast dusting and very fast dusting, but lot of literature, especially Traxer, mentions that more than 30 watts produces temperature. I am concerned when it is RIRS and ureter, I am not crossing more than 25 watts, but in bladder I go a little high, especially before enucleation. If I see 3 to 4 centimeter, I will fragments and do helix evacuation. Then I will go up to 6 joules.
Okay, thank you. 那么接下来呢，我们有这个另外一位国内的
Thank you. And then we have another expert from Peking University Hospital, Professor Wang Gang, on the board. I'm not sure if you have used the thulium fiber laser. Do you have any questions or comments? Professor Wang, please. Thank you, Professor Liu. I'm willing to try speak English.
Professor Mohan.
Yeah.
Very good presentation.
Thank you.
Because for flexible uretrophy, what kind of strategy is the best between dusting or fragmentation? There's a long debate, and each has advantages or disadvantages. And with the advent of the thulium fiber laser, we see a prospective future for its low energy and high frequency, maybe bring us very high effect of dusting. But from your experience, I found that you seldom use low energy, high frequency to dust the stone in the operation, in the beginning of the operation.
Yeah.
That means your experience, the dusting property of the thulium fiber laser is not work so well.
It is equal. There is no difference between holmium and thulium in the initial 5 to 10 minutes part of the surgery. It doesn't make any difference because in both settings 10 Hz 1 joule in a fragmentation mode and in dusting mode of holmium 10 Hz and 1, these are our standard settings. We feel that speed is same, so you don't have any advantage as far as dusting is concerned.
OK， 王刚教授还有问题吗？
So Professor Wang, do you have other questions? No more questions. Thank you.